Have you ever tried to learn about the disease that you were diagnosed with on Wikipedia? I know, it's boring. It will take you to the ocean of medical vocabularies that will leave you confused, so, finally, you'll close the tab. In this video, let us have a real knowledge in simple words. According to Google, 34.8% of the world's population is suffering from high blood pressure, hypertension. I know what you thought, I want to know about it to protect me from that disease. But, before that, let's learn about a few basic concepts of the blood pressure. What is blood pressure? Lateral pressure exerted by the column of blood on the wall of arteries, according to the medical books. Let's simplify this definition. When the blood flows from the blood vessels, it will exert some amount of pressure on the wall of vessels, exactly like the pressure of water on the wall of the pipe, is called blood pressure. How blood pressure is measured? Sphygmomanometer is the name of the device used to measure the blood pressure. The inflatable rubber cuff of it is tied to the patient's arm, and the bulb is used to inflate the cuff. The valve releases the pressure slowly and the stethoscope is used to listen to the heartbeat of the patient. The blood pressure reading could be seen on the gauge. As the heart beats, the blood flowing through the arteries will cause rise in the pressure, which is called systolic blood pressure. This is followed by diastolic blood pressure, when the heart is preparing for the next beat and the pressure in the artery is least. Systolic and diastolic pressures are commonly stated as systolic over. Diastolic 120/80 means 120 mm of mercury is systolic pressure and 80 mm of mercury is diastolic pressure. Yes, the unit in which blood pressure is measured in mmHg, millimeter of mercury. How is the blood pressure regulated? The process of blood pressure regulation is too complex, even for some doctors. Don't worry, this video simplified it for you. The video has told all the factors regulating blood pressure in a story form, hope you'll love it. The blood that returns to heart from body is called venous return. When it increases, obviously the heart needs to pump it out. More blood in a single beat means more blood pressure, so, with increase in venous return, as in case of exercise, blood pressure increases. The volume of blood pumped out of the heart in a minute is called cardiac output. You know that cardiac output increases when we exercise, so does the blood pressure. When the artery is elastic, it will get stretched, when the volume of blood flowing in it increases, so the effective blood pressure will be low, but when the arteries are stiff, it will not expand and the blood pressure reading will be high. The pressure that an arterial wall exerts on the blood is called peripheral resistance. When it is more, the blood pressure increases and vice versa. Overall blood volume in the body also plays a role. When body blood volume is more, the heart needs to circulate more blood in the system, which will result in it working at a higher pace. Hence, blood pressure will increase. These are the main factors regulating blood pressure. Other factors are viscosity of the blood, diameter of the blood vessel, and many more. Now you have the general idea about blood pressure, let's jump to the main topic, hypertension, high blood pressure. Definition of high blood pressure. Blood pressure more than 140/90 for a long time is called hypertension. Chronic hypertension is the silent killer, causes heart failure, aneurysm, brain stroke, metabolic syndrome etc. In a longer run. Classification of hypertension is displayed on your screen. Diagnostic symptoms of increased blood pressure. Severe headache. Confusion. Fatigue. Chest pain. Visual impairment. Breathing problems. Irregular heartbeat. Diet for high blood pressure. Dietary approaches to stop hypertension is the diet designed by National Institutes of Health, specially for people with hypertension. It decreases the sodium content in the diet and increases the amount of blood pressure-lowering nutrients like potassium, magnesium and calcium. The dietary guidelines include grains, 6 to 8 servings per day. Vegetables, 4 to 5 servings per day. Fruits, 4 to 5 servings per day. Dairy, 2 to 3 servings per day. Nuts, seeds and legumes, 4 to 5 servings per day. Fats and oil, 2 to 3 servings per day. Sweets, 5 servings per week. Lean meat, poultry, fish, 6 servings of 1 ounce per day. Complications due to high blood pressure. Blurred vision due to retinal damage. Kidney failure due to glomerular injury. Stiff arteries. What causes blood pressure to stay high? Two main factors that regulate blood pressure are cardiac output and peripheral resistance. One of it or both could be elevated in hypertension, generally in old age, peripheral resistance is high, and in young age, cardiac output is elevated in hypertensive patients. Reasons for increased cardiac output. 1. Increased sodium in the body leads to increase in blood volume leads to increased cardiac output. 2. Anemia leads to less oxygen in the RBC that will cause heart working more to supply oxygen to all tissues leads to elevation in cardiac output. 3. Hyperthyroidism leads to metabolic rate of the body increasing, which leads to pumping of the heart becoming fast and more effective leads to cardiac output increases. 4. Kidney disease leads to excretion of less water, which leads to more blood volume. Reasons for increased peripheral resistance. 1. More cholesterol deposits in arterial wall leads to stiff arteries that leads to increased peripheral resistance. 2. Constriction of blood vessels by hormonal response (RAS) of the body leads to more pressure exerted on the blood by vessels. Treatment of high blood pressure. Causes of hypertension should be tackled to treat the disease. 1. Increased sodium treatment will be to restrict sodium intake. 2. Anemia, hyperthyroidism, kidney disease treatment will be to treat the disease. 3. Increased body cholesterol treatment will be to decrease intake of fatty food and, if serious, take lipid-lowering drugs. Disturbance of hormonal regulation treatment will be the drugs working on RAS system. Treatment depends on the patient's overall health, age and other medicines that patient is taking. That's all about hypertension. Now, you are knowing almost 75% of everything under the name of hypertension. Even after watching this video, you have any doubts, feel free to leave a comment below. Don't forget to subscribe to the channel for more informative videos like this one.